I put this on mute and get it on? I have to go on mute.
Hello, everyone. We'll be getting started shortly. Please share your name and where you are joining us from in the chat box. Welcome, everyone, and thank you for joining today's webinar, Competencies in Focus Policy. My name is Abby Nellis, and I am a Senior Associate with CADCA's Public Health Programs team. CADCA, in partnership with the Center for Public Health Systems Science at Washington University in St. Louis, is excited to present today's webinar, which is the fourth webinar in our 18-part webinar series on CADCA's coalition competencies. Next slide. Before we dive in, I just want to do a quick overview of CADCA. Using a community-led approach, CADCA is dedicated to empowering coalitions and health departments across the globe with the tools, expertise, and support needed to drive positive change in their communities. Through top-tier training services and an evidence-informed technical assistance system, we help build your capacity to implement best practices that improve community health outcomes. To explore more about our work and subscribe to our weekly newsletter, visit cadca.org. Next slide. I am sure everyone is familiar with Zoom by now, but I'd like to go over a few housekeeping notes. All participants are muted by default, so for general comments, please use the chat box. We will have a Q&A portion at the end of the presentation, so for any specific questions for the presenters, please use the Q&A box. You will receive a post-webinar email with the recording of the webinar, slides, and an evaluation survey. We kindly ask you to fill out the survey. Letters of attendance are given only upon completion of the evaluation survey. And I do see we already have participants with their hands up, so if you have any questions, any comments, please go ahead and drop that into either the chat box or if it's a question, into the Q&A portion. Next slide. And now I'd like to introduce our presenters. Today's webinar will be led by our valued partner, Jessica Price from the Center for Public Health Systems Science at Washington University in St. Louis. Jessica Price is the Evaluation Manager at CPHSS and oversees evaluation and implementation science projects including CADCA Tools and Manuals, Reach St. Louis, and the Rural Communities Opioid Response Program. We are also joined by CADCA's Public Policy Consultant, Sue Thau. Sue is nationally recognized for her advocacy and legislative accomplishments on behalf of the substance use prevention field. She was a driving force behind the passage, reauthorization, and full funding of the Drug-Free Communities Act. In addition, Sue has worked to save and enhance funding for all federal substance use prevention and treatment programs over the last 2 decades. We are also joined by Rick Collins, co-founder of the Hawaii Alcohol Policy Alliance and the Maui Coalition for Drug-Free Youth, and he currently serves as coalition director for 3 community coalitions across Hawaii. Rick specializes in public health policy on alcohol, tobacco, and other drugs. His experience includes building new community coalitions, local and state level policy development, and community organizing to plan and implement policy strategies to reduce the harms of substance use. Thank you for joining us today. Jessica, I will go ahead and pass it over to you.
Hi, everyone. Thank you for joining us today. We are excited to share some information with you. And my portion, I'm going to keep really brief because I'm really looking forward to hearing from Sue and Rick. But what I want to do today is give a little bit of background on the competencies and the policy competency, introduce that competency, and explain a little bit about where it came from. Then we will pass that off for some great insights and a learning opportunity from Sue and Rick, and then learn a little bit more about how CADCA can support you in this area. So CADCA's coalition competencies fall into 3 domains: operations, community, and prevention. These are a set of competencies that were developed through an extensive research process, a scoping review of the literature, interviews with coalition leaders around the world to determine what are the core competencies that are needed for coalitions to be successful. We went through a 4-step process that included expert feedback, refining our model, working with a lot of key partners to ensure that this is a product that can be useful for CADCA as they shape the ways in which they support coalitions, and for coalitions as they determine where they're going to put their resources and energy as they build skills and abilities. Today, we're focused on policy. This falls under the prevention category in the coalitions, along with evaluation, assessment, evidence-informed strategies, and implementation. Here is the policy page. We designed these to be, for each page to be kind of a one-stop shop for information on what is the evidence for the policy, why do we know this is important, and then what are the research-based knowledge, skills, and abilities that coalitions need to be successful in this space. So we defined policy for this competency as engaging decision makers and community leaders to support substance use prevention programs, policies, and infrastructure. And there's some really important evidence on why policy is an important competency for coalitions to build. Policy successes can have huge impacts on a population. They can really make a difference in the lives of our communities. Coalitions are a wonderful tool to help bridge the gap between the local priorities and needs and the decision makers and the actions that can be taken to meet those needs. Also, policy work enhances coalition sustainability by helping to achieve long-term goals and lasting impact. So I'm going to briefly go through the knowledge, skills, and abilities that come under the policy competency. And as I mentioned, all of these come from a really extensive research process to go through and look at what is the peer-reviewed literature, what are the leading organizations doing, and winnowing that down into these essential knowledge, skills, and abilities that make a organization competent in, for this case, the area of policy. So you need a knowledge of community context, of the legislative process, of policy frameworks, and of what makes us healthy so that you know what you're even going to work on. For skills, you need skills in policy research, in persuasion, negotiation, implementation, and enforcement. For abilities, you need the ability to be focused on health outcomes. The ability to mobilize, that partner engagement, decision maker engagement is so important. The ability to translate research, to be able to communicate with your community about why this topic is important and what you hope to achieve through this process. And then the ability to engage in effective strategic coordination. So with that, I am going to hand the microphone to Sue to tell us more about, some examples from the field and some ways that this can apply to coalitions around the country.
Okay, well, thank you. Hi, everybody. So we're going to be using something that I developed called the frame to accomplish policy goals. The next slide, please. Yeah, so the frame, and we're going to go through this in detail. F is facts, R is reduced to 1 page, A is anecdotes and stories, M is how to map out your advocacy strategy, and E is how to evaluate your results. Next slide, please. Okay, facts, the data. Next slide, please. We're going to go pretty fast through this. So it's really important when you're going to be coming up with your advocacy strategy and priorities to base it on data, research, and facts. Basically, preferred sources or government sources, peer-reviewed literature, etc. Next slide, please. Obviously, don't use Wikipedia or any unsourced websites. You're going to get in trouble for that. And make sure everything is cited when you use data to make your case. Next slide, please. Okay, The R is reduced to one page. Why is that important? Decision makers and policymakers are very busy. They don't have time to read big reports. So if you have a big report, the thing to do is to reduce the findings to one page, so it's really easy for decision makers to be able to understand what the data is, where you got it, and why it's important. So next slide, please. So this is an example from Monitoring the Future. If you're trying to make the point that alcohol is the #1 drug used by youth, this is a perfect way to do it. It shows that, you know, of all of the past year drug use among 12th graders, alcohol is #1. Next slide, please. Okay, the next, so we have F, facts, R reduced to one page, A, anecdotes. Next slide, please. So anecdotes put a face on the data through using stories that make the data relevant and relatable. Next slide, please. Anecdotes actually really matter because they make data resonate, they make data human, and they're the element in this that makes people get it. Like if you're talking about underage drinking, bringing someone along who's had consequences from underage drinking to put a face on the data really makes a difference. However, anecdotes are necessary, absolutely not sufficient. You cannot go in with only anecdotes. You actually need to start with the data and then use the anecdotes to help put a face on the data. Next slide, please. Okay, so now we're to the M, which is how to map out your advocacy strategy. Next slide, please. So you have to know what you want to change. Is it a law? Is it a school policy? Is it a zoning thing? Very, very, very important. Next slide, please. Then you have to figure out who has the power to make the change that you're trying to make. Obviously, if it's a law, it's the legislature. If it's a zoning issue, it's the zoning board. If it's a school policy, it's probably the school board. Really important to understand who has the power to make the change you're trying to make so that you go to the right people and the right system to be able to do that. Next slide, please. So for changing a law, it's the legislature at any level. The local level, it would be the city council or county commission, state level, state legislature, and federal, the federal Congress. Next slide, please. So what people in the system do you need to get to be able to make the case for the change that you're trying to get implemented? Next slide, please. So you have to know and fully understand the process to get a law passed at whatever level you're trying to get an ordinance or a law passed. And you also have to understand the difference between authorizations and appropriations. There's a lot of misunderstanding about this. If you want to get something authorized, it puts the program or the policy on the books. But to get it funded, it goes through a separate process, the appropriations process, which is handled by different committees at all levels of government. So if it's a funding thing, you need to do the appropriations committees. If it's trying to get something on the books, it's the authorization, and you need to work with both if you're going to get something on the books and also funded. So you need both committees or all of these committees and the people on them involved. Next slide, please. So as I said, authorization legislation establishes an agency, a program, a project, or an activity. Authorization does not provide funding. Next slide, please. And again, appropriations is how to get money appropriated for whatever it is that you've just gotten passed as your policy or your new program. Next slide, please. So it's really important to engage champions in the system that you're trying to work with, because we can bring ideas to people, but they're the ones that actually need to get it introduced and get it moved through the system. Next slide, please. So identify who the key champions are in the system that you're working with to try to make your change in. So is it elected officials? If you're trying to change something? Is it business leaders, foundations, non-governmental organizations? Who are the key champions that are going to help you get whatever it is you want done? Next slide, please. So to maximize impact with champions, obviously we need to set up meetings with decision makers. You need to present your data, your anecdotes, and your messages. Always follow up, always say thank you. It's amazing how many people have meetings and never follow up and say thank you. And building relationships with these champions to keep them informed on a regular basis is critically important. If you ask somebody that you don't know for something, they're very likely to ignore you. If they already know you and you have a relationship with them, they're much less likely to do that. So building relationships with key champions over time and keeping those relationships going is really critical. Next slide, please. So we need to go after support from those in the system who already agree with us or are undecided. Forget about meeting with hard opponents in the system because they've already totally made up their minds. And what you're going to do is go in and meet a brick wall, but you're also going to end up giving them all of the information that we're using that they can then turn around and use against us because they'll understand exactly what we're trying to do and why. Next slide, please. So you keep the following in mind in anything you're going to do with advocacy. Do the work for them. Provide legislators with data, talking points, examples of what it is you want them to do. Ensure all of your written output is clear, concise, and understandable. You really, really need good, powerful sponsors and co-sponsors in the system that you're trying to affect the change in. So basically, you want people who are on the right committees to be able to introduce and move the legislation through the process. Absolutely be sure that you're bipartisan. Do not ever just go to either only Republicans or Democrats. You need at least one Republican and one Democrat on any piece of legislation at every level of government. Try to get as many other co-sponsors as possible on whatever it is you're trying to get passed into law, and work with your allies to increase support and get additional co-sponsors. If you have legislative champions, use them to help gain additional support. Another thing is try to get anything you're doing introduced as early as possible in a legislative session. Many good bills die because they're introduced too close to the end of a legislative session and there's no time to really move them. And localize your data and your anecdotes as much as possible, and also make sure that they're from the district of the people that you're trying to convince. So at the federal level, if I'm going into someone and asking them from New Hampshire to help us, I would go in with New Hampshire data and New Hampshire people. It's the same at the state level. Use the people who they represent and make the data as localized as possible. Next slide, please. So timing is always critically important. The earlier you make your case in any process, the better. Next slide, please. Find out what major issues the decision makers you want to influence care about. This is really important. Next slide, please. Determine their top priorities. Anything that we do in substance use prevention can have an impact on educational outcomes, public safety, health, and the economy. And we can, next slide, please, connect the dots for them from our issue to the issues that they care about, so that when we go in, we know what their priorities are, and we can make sure that they understand how substance use prevention and reducing population rates of substance use result in higher educational achievement, lower healthcare costs, etc. Next slide, please. Specifically tailor data and messages to their priorities. So that was connecting the dots. Next slide, please. And ask yourself, what would it take to make them care about this? And again, this is how you use the people in your coalition to make the case, to put a face on the data and how to tell a story that makes people really connect with what it is you're trying to accomplish and why, and that what would it make to take them act on caring. A lot of people have their own personal issues involved in our field, and looking into the backgrounds of the people you're meeting with and figuring out if they have any family members who have had issues, etc., that would make them care about acting on this is really important. A great example of this is ex-President Biden. His first wife and daughter were killed by a drunk driver. These issues became personally really important to him, and he became a really gigantic champion for us when he was in the Senate. Next slide, please. So document your case to meet their priorities. Again, connect the dots for them using facts, statistics, and anecdotes. Always cite your sources. Next slide, please. So know before you go, again, you need to understand the personal history of the people you're going to be meeting with. Do they have a family member with substance use disorder? Are they members of a civic organization? Do you have similar hobbies, children on same sports teams, etc.? Their electoral history, are they facing an election soon where they really care about making something happen that they can point to? The committee assignments and their leadership assignments, these are the people that you want to make sure you're champions because they're the ones that can get stuff moved through the process. Their relationship and support for or opposition to substance use issues and other areas of interest. All these things are very important to know before you go to meet with anybody. Next slide, please. So who are you going to bring with you if you get a meeting to make your case, and why are you going to bring those specific people? Next slide, please. Okay, so you obviously want to bring the people who can speak to the data and can speak to the one-pagers that you're going to be bringing along. So people who have expertise and really can make the case for you with the data. Next slide, please. You're going to also want to make sure you bring the people who are going to put a face on the data, tell the anecdotes. I would definitely train youth, especially for any issues that have to do with marijuana or underage drinking. So how do you prepare for your meetings? You definitely have to set your agenda ahead of time. Next slide, please. And the do's and don'ts of meeting with any legislators, you have to be brief. These guys are generalists and they have a tremendous amount of people who try to meet with them. You never get more than 10 to 15 minutes with a member and probably no more than 20 to 30 with a staff person. Definitely share your expertise and your insights and your data.
Okay, it looks like Sue might have frozen a little bit. So let's see if we can just hop ahead maybe to Rick's portion of the present. Oh, she's popped back up.
Okay. Hello. Sorry about that. I got kicked out of the Zoom. Thank you, Chris. Sorry. Did anyone else get kicked out or it was just me? Everyone else is on mute. Okay, well, I'm very, very, very sorry about that. Always thank legislatures. Don't overwhelm legislators with a whole bunch of information. Again, that's the reduced to one page. Do not use jargon or acronyms. Nobody knows what the SPS is except us. They will not know what you're talking about if you do that. And never back anybody into a corner or become negative. Just basically thank everybody, whether they agree with you or not, after the meeting. Next slide, please. Okay, other tips and tricks for successful legislative meeting. Always designate one person to be the primary spokesperson. Be very brief with your introductions. I can tell you when I first started in this field, I had a meeting with some very important people, and by the time they were finished bragging about how important they were, the meeting ended and we had never even got to talk to them about why we had come in the first place. Definitely discuss the accomplishments of your coalition and your program. That gives you a lot of credibility. Absolutely end these meetings with asking how you can foster a continuing relationship with them and their staff where you become a source of information and data and a trusted ally to them. I would definitely invite youth to participate in meetings by being the ones to share, be trained to share the data and also to share anecdotes and put a face on the data. And always ask legislators and their staff how to provide follow-up materials to them so that you can keep in touch with them throughout the whole process and even just to build a relationship with them. Next slide, please. Most importantly, always have a clear ask. Don't go in just in general. They're really busy. So know exactly what it is you're asking of them before you go in, and then build your whole meeting around the clear ask that you've come up with. Next slide, please. So frame, facts, reduce to one, anecdotes, reduce to one page, map out your strategy, and then the E is evaluate your results. Next slide, please. So did your meetings go well? Why or why not? Did you get the responses you wanted? Why or why not? And what else do you need to do moving forward? You really do need to evaluate what worked, what didn't, so that you can change moving forward what you're doing on the margin to be able to take into account how everything went. Next slide, please. And I am now going to turn it over to Rick to give a real local example of how he used all of what we've just talked about to make big policy changes.
Hey, thanks, Sue, and I'm so relieved that we followed the frame in so many ways without ever calling it the frame, and so I hope that comes to life here in the story I'll share. So I also want to just start by saying, so these are my three community coalitions and a statewide coalition that I help to oversee. But I want to start by saying, I think we're all three of our coalitions are pretty normal coalitions, and that might offend some of our partners, but I think that's really important to share because it's not like we came in with this giant policy muscle. We had no one with policy experience, including myself. We sort of grew into that. And one of the ways that we sort of grew into that is by talking about the desire for us to have a large community impact. And in the public health space, there's just almost no other way to have big community level impact than working on policy. And so next slide, please. And so I'm going to essentially walk you through our sort of lifespan of getting to our social host ordinance policy. And that's the policy that I've chosen for this one. Now all three of our coalitions only work on policy. We certainly have supportive individual strategies, but we had to get people to a place where they were committed and comfortable to that. And so what I'm going to do is sort of show you the lifespan of our coalition in getting to that place. And as I'm talking to that, I'll be sort of trying to weave in these sort of knowledge, skills, and abilities that we know around policy. And I'd just be thinking about in your own circle, sort of where is your coalition in its lifespan of being ready to work on policy or introduce, implement policy, evaluate it, whatever that might be. So really when we started this, and this was probably 2016 or something like that, we started really with this understanding that people had to have a framework and an understanding of what we mean when we talk about prevention. And I would say that 99% of our field and 99% of our local communities see the problem of substance use as a personal choice, usually a bad, unhealthy choice that individuals make that creates a community problem. And that is certainly one side of the paradigm, but as many of you now know, and where we sort of started with this is thinking about the importance of shifting to the other paradigm, which is the environmental paradigm, which is that we live in a community where there is economic, social, environmental contexts that make that where we interact with substances, usually as it relates to how they're priced, how available they are, how attractive they are in communities that influence people's choices. And so we really started at this sort of groundwork of conversations over a number of months where we brought in different sort of interactive activities to sort of open up partners to this idea that there's another paradigm out there, that it's not only about individuals making choices, it's also about the environment in which we allow substances to be promoted, available, cheap, attractive in our communities that also influence our behaviors as a larger community. And so a lot of you know a lot of these sort of activities. It's the frog in the pond. It's the this upstream approach. It's this idea of getting upstream and looking at root causes in the community. And we really did this in a way where we weren't trying to stuff policy down the throats of partners around the table. We were having open discussions and getting people comfortable. And so the first piece really became this idea of introducing them to policy frameworks and getting people committed and to the idea that if we work on policy, we can have big change and we can have sustainable change over time. Next slide. And so once we sort of got to a place where we were like, okay, let's think about what we might be able to do to shift into this environmental prevention side of the paradigm versus just maybe teaching skills or building awareness in the community that would inform people to make better choices. What can we find out that's really happening in the community that might be conducive or creating an environment in which it's much easier for young people to be drinking or accessing alcohol? And what are some of those consequences? And this speaks to what Sue was talking about in terms of the anecdotes and the stories. So what we knew, which is what, again, I think 99% of us know in our coalitions, is we pulled youth survey data and we said, all right, we know what the binge drinking rates are. We know what the 30-day use rates are. We know a little bit about root causes, but what we didn't know is we didn't really know much about our local conditions. The youth survey data just doesn't go deep enough. It doesn't really talk about the settings where young people are getting alcohol. It doesn't speak to anything around the high-risk settings where they're drinking alcohol. It doesn't really speak to the consequences associated with alcohol use by young people in the community. And so we really wanted to get down into the weeds, so to speak, and identify these local conditions. Next slide. And so essentially what we did is we built a data collection and an outreach plan. And we said we really have to collect some local qualitative data in our community to better understand this. We understand we've got a problem. We had the second highest drinking rates of any county in our state, both in binge drinking and 30-day use rates, but we didn't know what that actually meant or looked like in our community. And so we essentially built out this 4-part data collection plan that included informal surveys that were really short, 10 questions. We did one-on-one interviews with individuals throughout our community. We even did observations. We would hear about certain places where there might be high-risk drinking happening, and we would literally go out to places and scan them. So we'd hear about a particular beach in our community from one group of young people, and we'd find out, well, when are the high times for that? And we'd literally go out as a community and we'd go scan those. Or we heard about a particular park on a Saturday night, and we'd go out and we'd observe what's happening in those areas. We did a number of listening sessions, both in the adult space and in the young people space, of really hearing what Sue was talking about, the anecdotes, the stories. What does this really look like? Where are some of these settings where there's lots of drinking going on, where young people are congregating in places where more of the mob mentality of drinking to excess becomes sort of the game, where there are potential consequences that are happening? And so we compiled this sort of rich anecdotal data that we came back with that wasn't going to be in any report, any police report, any youth survey, because oftentimes these things go unreported. And so essentially, go to the next slide, please. We came back and what we found out was we really had a high risk setting in our community of underage drinking happening in homes, in home settings, in graduation parties. And this is oftentimes where young people were getting the alcohol too. They either stealing it from their parents' stash, or they were having older siblings bring the alcohol to the parties, things like that. And so what we essentially focused on is we said, okay, we sort of know now a local condition. We've got this high risk setting, this local condition of young people drinking in homes with and without parents around. We found out from law enforcement, graduation and prom season are kind of the highest risk times in the community where that's happening. And we found out that there were a lot of consequences associated with this that were going way unreported. You just weren't going to find these in any reports. Even law enforcement were talking about things that they weren't necessarily reporting because they weren't reportable in their system, but they knew they were happening. Next slide. And so based on that, what we did is we started with an education campaign. And we started with an education campaign externally to highlight the problem. And we started with an education to ourselves. We said, okay, now that we know this information, what are some of those policy solutions that we can do that are going to address that specific local condition, that specific setting of drinking in homes? And the policy that we selected after looking at a number of things was the civil social host ordinance. And so there was this internal piece we did around educating ourselves, and this speaks to that knowledge base within the policy core competencies, that we really needed to understand the community context. We needed to understand what policy solutions were out there and available, and we essentially needed to become the local experts on the social host policy and being able to speak to the problems and the challenges that are existing around the community and underage drinking that often are going unreported and unnoticed by most of the community. Next slide. That's my son, by the way. So what happens is when you are the staff and you need a cute kid, you put your own kid in the picture. All right, never mind. I just think he's so daggone cute, but I know I'm biased. So the next piece we did is we said, okay, we're committed to this social host ordinance. We did some in-person multi-day trainings with ourselves, and we came up with a campaign framework, and we used the 10 policy development steps that are in the National Coalition Academy as a design framework. And this speaks to Sue's M around mapping your strategy. And this gave us an opportunity to work internally first on what we needed to do to essentially build our knowledge and our skills and our abilities to get ready for the policy piece without getting out in front of it and in public without having built those skills and knowledge and ability sort of components. And so in the policy development steps, there's a number of internal steps you do. Usually, I think that took us probably at least a year to sort of build those out, where we felt comfortable with understanding the policy. We felt comfortable with understanding the issue. We essentially built a structure, a policy structure with work groups, and we really clarified this lobbying and advocacy piece that I know a lot of coalitions get nervous about. And I often hear coalitions say, well, we can't lobby. And I just to say, part of my life's mission is to normalize that we can lobby. And in fact, any law that's on the books, somebody had to lobby for it. It's a normal civic right and duty when we're looking at policy. We just have to make sure we do it legally. People are often surprised that I'm both a coalition director and I'm a registered lobbyist, both in my local county, and I'm a state registered lobbyist in the state legislative process. And so you can be both. You just can't mix your funds, and you got to have funds that support your lobbying dollars, and you got to make sure that your restricted funds or for education purposes only. So we did all of that internally. Next slide. And this is just to show some of the activities, certainly not all of them, but I wanted to speak to some of them of what that policy development framework looked like in action. And you could be thinking about how this sort of helped build our knowledge base, help build some skills, and essentially led us to a successful campaign in passing a civil social host ordinance, the first of its kind in our state. So we built a youth coalition or a youth council. That was one sort of piece of the activity where young people were at the front of this, talking about this, advocating for this. They actually lobbied for this in a number of ways. Next slide. And Sue, I'm so happy again, I'm following your frame. We didn't know the frame. We distilled our information down to one page, which we called an issue brief. And that laid out what's the community problem that we have in front of us? What's a solution to solve that problem? Who supports that problem in our community? And what can you do if you want to get involved? And so we distilled that down, and anywhere we went, we were giving this out. And the other thing we started to do is we started to meet with lawmakers ahead of time to understand what Sue was saying, that legislative process. When I have new coalition coordinators come on board, one of the first things I have them do is start showing up to our county council meetings. I said, go to county council meetings, go to the committee meetings. I want you to see what the dynamics of the county council members are. I want you to start to know what their interests are, what they're advocating for, what they're against, what the dynamic is, because that's so important in the policy process or the legislative process. And so we'd start handing these out, and we looked really professional, right? Like we looked like this was not a fly-by-night idea. We were really sort of armed and ready to talk about this, and it was clear that we were the local experts and that we had built a base of support around this. Next slide. The other thing that we did is we got out in the media at the front end, and we started talking about the issue before we talked about the solution. And so one of our good colleagues, David Jernigan, did a training for us, and he's a guru in this, and Sue works with him closely around how do you start to get your issue on the radar with your community ahead of time so that you're not bringing in a solution when people don't even know that a problem exists. So we spent about a year or so really building up to and talking about the importance of keeping young people safe in our community, and that one of the areas that often goes unchecked is these house party settings, prom season, graduation times, when young people are reporting that problems are happening, that there's a lot of consequences associated with that. And our real goal and our value that we share as a community is keeping young people safe and having them have a healthy future. And so we did dozens of media pieces around this. We did letters to the editor. We started a social media account. And so we did some owned media, but we did earned media, and we built relationships with the media in our community to make story-worthy articles about what we were doing and how we were trying to start working on a solution around this. We did town hall meetings. We did a lot on the front end before we said, we need a social host ordinance. We didn't go in with that. We needed to frame the issue of this is a concern and we can do better in our community. We can create a healthier environment for young people. Next slide. We educated ourselves on the policy ordinance before we ever went to a local council member and said, we need a social host ordinance. Can you draft something? To Sue's point, we did all the work ahead of time. We got the data. We looked at other communities that were like ours and got different ordinances. We identified the difference between a civil and a criminal ordinance. And we found out we needed to really commit to a civil ordinance. That was a deal breaker for us. But we had all the information to back that up. We had talked to local prosecutors, defense attorneys, corporation counsel, and we knew exactly what we wanted. So when we found our champions, we came in with the bill in its sort of form that we knew was the best possible case, and we were able to defend it. So all this stuff sort of goes into that piece around we built our ability to negotiate, know what our deal breakers were. At the end, we ended up negotiating a little bit of a different bill, but we didn't give away those deal breakers. This was all important piece to the startup. And as you're thinking about where are you at in this, this can also be an important part of your process, is making sure that you really understand thoroughly your policy before you ever make it public. Next slide. Obviously, we had to testify. We figured out how to do that. We had lots of activities where we tried to make it fun to talk about the sort of unspeakable fears we had around, going public with a policy campaign. We did an activity where we said, let's lay out all the things that we're so afraid people are going to ask us about this, that we just wish we could hide behind a bush and not have to answer this difficult question. Whatever difficult question, whatever argument to our policy and our campaign that we have, let's get it out and surface it. And let's find some creative ways in which we're going to talk about that in the community. And so we built this arguments list and counter arguments list. And so we weren't fearful of questions. We were trying to invite questions to come in. And so it speaks to this idea of we were trying to create this sort of persuasion. We were trying to be reasonable. When we mobilized people, it was easy to talk about some of the questions that people had that came up because we were sort of equipped and already organized and had developed talking points around some of the tough questions we knew we would face. And lastly, if you go to the next slide, we tried to celebrate wins. And so if you go to the next slide, I got a little picture of us. We tried to do We tried to do some wins. We tried to make sure we were celebrating our success when we could. That was really important in building our momentum. At the end, we ended up having, I think we ended up having 3 hours of testimony in support of our bill at one of the hearings, which was just phenomenal. But I just want to say, we started out as like a group of 10 people. And so if you're just like, well, I just have 10 people, that's all you need. If you got 5 people, that's all you need. Start with where you're at, and you can build to something like that by using a framework, a policy framework like the frame or the 10 policy development steps. The commitment to the work is core, and I think the first step. So what can you do? Next slide. There's a number of things you can do. You probably sort of heard some of those already in my presentation. You could start with where you're at. Are you at a place where most people still have the paradigm of thinking that our problem is an individual problem of people making bad decisions? If that's the case, start with the paradigm shift. Start with thinking about and going out and observing your environment. Go out and have people look at what products are out there: cannabis products, alcohol products, tobacco products, how they're marketed, what their designs are, the price of them, things like that, to get people start to think about, oh, there's more to this than just choices. Build your policy knowledge and frameworks. Go understand your legislative process. There's no reason you can't go meet with your county council, your city council, whoever your decision makers are now, and just introduce yourself. At some level, you're a breath of fresh air if you come into a council member meeting and you have no ask. We're out exploring what the issues look like, and we came to talk to you. Like, most people come and they want something done immediately. If you come and you just sort of introduce yourself, start to establish relationships with their staff, you're not lobbying. You're simply understanding and building your base of knowledge and skills around the legislative process. Get commitments from partners to start working on this. Those are other things you can do as well. Next slide. And of course, if you're saying, well, we're beyond that, we're sort of ready to go, we think we can do this. Sorry, the slide got a little mixed up from Canva. But you could start to research what you can do as a policy solution. Again, trying to move beyond just individual awareness campaigns or decision-making sort of strategies or refusal skill building, but what are some policies that would support people's decisions in the community? Build a structure that's policy ready. We did a lot of our work groups based on a sort of an ad hoc basis. It was like, we need a one-page infographic. We called it the Infographic Work Committee. When they were done with that infographic in a couple of months, they disbanded, but they had something really something that they could contribute to the campaign, and see the works of the fruits of their work, so to speak. So those are just some places to start. I think assess where you're at and have fun with it. I got to say, have fun with it. It is a fun ride. It's not easy, but you can make real change, and you can make lasting change in your community. I think that's all I got.
Thank you, Rick and Sue. So we'll get to the Q&A portion in just a moment, but you might be wondering, how can I increase my coalition's knowledge, skills, and abilities in policy? Next slide. Well, here at CACA, we focus on this crucial competency during our National Leadership Forum and our Mid-Year Training Institute, and through various coalition services and training programs, many led by Sue. Additionally, policy is covered in our National Coalition Academy and extensively in our newly launched Policy Academy. Next slide. While we are moving into our Q&A, I'm going to go ahead and put the evaluation survey in the chat, and I'll get Jessica to put the QR code up here on the screen. But we kindly ask that you please fill out the evaluation survey. As a reminder, letters of attendance are only given upon completion of the evaluation survey. So let's move into Q&A. Please remember to put your questions in the Q&A box. Next slide. Or actually, no, sorry, Jessica, keep it on the evaluation slide. First question. Can you give more of a detail on what/how to use anecdotes?
I can start. Yeah, absolutely. So when you're putting together your strategy, it's basically, and Rick can speak to this too, what's the problem that you're bringing? So his was kids are accessing alcohol in their community through friends, family, parties. So how do you put a face on that? Well, has anybody been hurt leaving one of those parties? You can bring in the parents or the kid if they didn't you know, have a fatal accident. It's really thinking through, and if you're going to be doing something that has to do with people accessing alcohol in a different way, say through bars, restaurants. Again, it's bringing people who have been impacted in the community who can actually speak to why that particular policy has impacted their lives, their family, their friends, their peers. And it's someone who can put a face on the data. I'll turn it over to Rick if he has anything to add. But it's bringing people who can really explain the data with personal stories and anecdotes.
Yeah, that's right, Sue. I think what I'd say is the way it's not done is conducting a community survey. So that's not how you get the anecdotal stories. You actually go out and talk with people. So you get out from behind your computer. And my own story was I started talking to some of my friends, like my literal friends. I'm like, look, I know I usually hang out with you as a friend. Let me put my like work hat on and talk to you about this. And they actually disclosed to me things that happened in their this was a few of them, like that happened in their high school years that were really like traumatic to them related to this. And I was like, oh my, I've never heard you talk about this, Sarah, or I've never heard, you know, I talked to a mother who had a high school, this is a friend of mine. She had high school kids and she said, you can't imagine the immense pressure I'm under to have my kids have parties where they're drinking because they say so many of these other parents are allowing it. And it's just like, I'm fighting tooth and nail. And so it was like those types of stories that just started with conversations and you just don't know until you start asking. And I started with that I knew.
And I'm going to give another example that I think really does it. You know, we've been trying to close the loophole that the Farm Bill from 2018 allowed for synthetic cannabinoids. And a group of youth from Minnesota, it turns out that their representative was the chair of the subcommittee that was going to make the decision on whether they were going to close the loophole or not. And these youth went in and explained that they cannot go to the bathroom in their school at all because the kids who are vaping these products are like, get out of our vape room, do not pee here. And that they literally had to, like, you know, not go to the bathroom, hold it in. One of the kids explained that they had a urinary tract infection from what was going on. That when we went to meet with that specific representative later to give them an award after they had met with these kids, that had so made an impression on this congressperson that he totally supported us. And it was all because they had shared the data, but it was more putting a face on the data that this really affected everyday kids in their everyday school lives.
Thank you, Sue and Rick. What are the most effective ways to train youth for policy meetings regarding underage drinking and marijuana use?
You want me to take that one for now, Sue?
Yeah, I can follow up, sure.
Okay. So I think you do something similar that you do with the adults. There's a number of curricula out there. I think getting them out in the community and having them observe this environmental lens with this environmental lens on, like young people when they see it, like they get really upset about this. Like they're essentially being preyed upon by many of these for-profit industries to get them to use their products to assimilate to those. I just saw Campbell's Soup is partnering with Pabst Blue Ribbon to do beer soups and things like that. So I think igniting young people want to make big change. Like they have big dreams. I think it's making sure we don't squander those by making them do other small things. That's not going to sound right. But I think not having them go out and educate young people, but instead be really community change makers and to know that they can get out there in the media. They can do a signing event. They can go to their local decision makers and talk to them about this. I think building the skills for them to become youth advocates is not only important for our issues, but it's important for them in their lifetime. You can apply that to anything. That I think gets youth excited. I have a small group that's meeting today at my house. Has my son in it and some other young person who I know. This is day 2 of them doing a little mini youth council here at my house that's going to expand beyond my house here shortly. But that's what we're doing. And we're helping them have that framework and that lens. That's what I would say.
And I want to say, I think that youth need to be involved in looking at the data. So at the youth survey data, at whatever other data your community is going to collect, they need to be trained on how to speak to the data and to be able to present it in a clear and concise manner. And then they need to be trained on how to put a face on the data to be able to tell the anecdotes that go along with it. It does take training, it takes practice, and it takes knowing how to do an elevator speech. So I think working with youth on training them on how to go through the frame and how to speak to elected officials at every level should be definitely a part of what your coalition does, whether you have already a group of youth who are, part of your coalition, or if you have a youth coalition, all of those kids, this should be something that all of them are trained to be able to do and to be able to speak at hearings. You get 2 minutes usually at a local hearing to speak, and it's being able to figure out how to practice to be able to get down to the 2 minutes. And again, I think youth are the most important voice that we probably have on these issues.
Yeah.
Okay, next question. Can you explain more about how focus groups differ from listening sessions?
You want to take that, Rick?
Sure. In short, focus groups are a bit more directive in terms of the types of questions they ask. Listening sessions are a bit more exploratory. You often go in with, 4 or 5 questions only, and the group sort of takes it where they take it. And so a listening session may ask questions like, talk about how young people are sort of getting this. Where are they drinking it once they get it, or where are they using it once they get it? And you're letting them sort of take it where they want to go. Focus groups just have more structure to them. Personally, I like listening sessions more, probably because I'm a bit less organized as a person. So it works for me, but I'm not directing it as much either when I'm talking. And so I prefer those. Sue?
No, that was a great answer. Thank you.
Okay, we are running close to time, so I'm going to go ahead and have this be our last question, and then we'll save the other questions that are asked, and we'll ask Sue and Rick to type up their answers, and we'll send all of those answers out to you guys in the post attendee email that comes out. And thank you all for all of your great questions. We've had some great questions today. But last question, how did you organize your listening sessions, and what did you say to get the conversations going?
So we start by making an outreach plan of who we did listening sessions with some adults, but we focus mostly on the listening sessions with young people. Who has access to young people, particularly high school people, young people, because they're going to be exposed more to that. And the questions that we ask are pretty simple. Think about getting to your local condition, getting to those settings. So I'm really curious about how are young people getting it specifically in the community? Are they stealing it? Are they buying it? Is the older brother getting it to them at the parking lot on Fridays at the school parking lot? How is it that they're getting it? And then once they get it, where are they drinking it where there's riskier problems associated with that setting or that condition? Is it at the skate park? Is it in homes? Is it on Friday nights at the football games? And so those to me are two. The third one then is what are the problems associated with those settings? Because that puts the face on it and that tells the story. If you don't have a problem, it's going to be really hard for you to pass a policy. I know there is a positive framework and that is important, but it's also important to let the community know that young people are suffering. And if we continue to do nothing about this, it's going to continue. And so you have to surface the consequences and make the case that there's a problem to be solved.
Can I jump in really quick, Abby, to make a plug for talking with your local colleges and universities, if this is an area where you would like some support on Our center works with a number of coalitions in our local area to provide just this kind of support that you may find that your local School of Public Health or other folks working in that space at a local university have expertise and could become another partner with you in holding really great and effective listening sessions and focus groups and data collection.
Well, thank you, Jessica, Sue, and Rick. If we could go ahead and go to the next slide. And as we conclude the webinar today, a big thank you to our presenters and then also to the attendees for your participation today. Our next webinar will be on September 17th and will focus on assessment. The registration link is in the chat. And then our October webinar will be on October 15th. So save the date. If you have any questions about today's session or where you can find this competency at CADCA, please feel free to contact me at anellis@cadca.org. And thank you again for joining us, and we hope you have a wonderful rest of your day.
Thanks, everyone.